Mental health encompasses emotional, psychological, and social well-being, influencing cognition, perception, and behavior. Mental health plays a crucial role in an individual's daily life when managing stress, engaging with others, and contributing to life overall. According to the World Health Organization, WHO, it is a state of well-being in which the individual realizes their abilities, can cope with the normal stresses of life, can work productively and fruitfully, and can contribute to their community. It likewise determines how an individual handles stress, interpersonal relationships, and decision-making. Mental health includes subjective well-being, perceived self-efficacy, autonomy, competence, intergenerational dependence, and self-actualization of one's intellectual and emotional potential, among others. From the perspectives of positive psychology or holism, mental health is thus not merely the absence of mental illness. Rather, it is a broader state of well-being that includes an individual's ability to enjoy life and to create a balance between life activities and efforts to achieve psychological resilience. Cultural differences, personal philosophy, subjective assessments, and competing professional theories all affect how one defines mental health. Some early signs related to mental health difficulties are sleep irritation, lack of energy, lack of appetite, thinking of harming oneself or others, self-isolating, though introversion and isolation are not necessarily unhealthy, and frequently zoning out. Mental disorders. Mental health, as defined by the Public Health Agency of Canada, is an individual's capacity to feel, think, and act in ways to achieve a better quality of life while respecting personal, social, and cultural boundaries. Impairment of any of these is a risk factor for mental disorders, or mental illnesses, which are a component of mental health. In 2019, about 970 million people worldwide suffered from a mental disorder, with anxiety and depression being the most common. The number of people suffering from mental disorders has risen significantly over the years. Mental disorders are defined as health conditions that affect and alter cognitive functioning, emotional responses, and behavior associated with distress and/or impaired functioning. The ICD-11 is the global standard used to diagnose, treat, research, and report various mental disorders. In the United States, the DSM-5 is used as the classification system of mental disorders. Mental health is associated with a number of lifestyle factors such as diet, exercise, stress, drug abuse, social connections, and interactions. Psychiatrists, psychologists, licensed professional clinical counselors, social workers, nurse practitioners, and family physicians can help manage mental illness with treatments such as therapy, counseling, medication, and trauma-informed care. Mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn and work well, and contribute to their community. It has intrinsic and instrumental value and is a basic human right. Mental health exists on a complex continuum, which is experienced differently from one person to the next. At any one time, a diverse set of individual, family, community and structural factors may combine to protect or undermine mental health. Although most people are resilient, people who are exposed to adverse circumstances are at higher risk of developing a mental health condition. Mental health conditions include mental disorders and psychosocial disabilities as well as other mental states associated with significant distress, impairment in functioning, or risk of self-harm. Many mental health conditions can be effectively treated at relatively low cost, yet health systems remain significantly under-resourced and treatment gaps are wide all over the world. Risks and protective factors. The risks and protective factors that influence mental health operate at multiple levels. Individual factors such as emotional skills, substance use, and genetics can increase vulnerability to mental health problems. Social and environmental factors, including poverty, violence, inequality, and environmental deprivation, also increase the risk of experiencing mental health conditions. Risks can emerge at any stage of life, but those occurring during sensitive developmental periods, especially early childhood, are particularly harmful. For example, Harsh parenting and physical punishment can damage child health, and bullying is a leading risk factor for mental health conditions. Protective factors similarly occur throughout our lives and help build resilience. They include individual social and emotional skills, positive social interactions, access to quality education, decent work, safe neighborhoods, and strong community ties. Mental health risks and protective factors can be found at different scales. Local challenges affect individuals, families, and communities, while global threats, such as economic downturns, disease outbreaks, humanitarian emergencies, forced displacement, and climate change, impact entire populations. No single factor can reliably predict mental health outcomes. Many people exposed to risk factors never develop a mental health condition, while others may be affected without any known risk. However, the interplay of these determinants collectively shapes mental health over time. Mental health promotion and prevention. Promotion and prevention efforts aim to improve mental health by addressing individual, social, and structural determinants of mental health. Interventions can be designed for individuals, specific groups, or whole populations. Because many determinants lie outside the health sector, effective promotion and prevention programs require cross-sector collaboration. Education, labor, justice, transport, environment, housing, and welfare sectors all have vital roles. The health sector can contribute by embedding promotion and prevention into its services and by leading or supporting multi-sectoral coordination. Suicide prevention is a global priority and part of the Sustainable Development Goals. Key strategies include limiting access to means, promoting responsible media reporting, supporting social and emotional learning for adolescents, and ensuring early intervention. Banning highly hazardous pesticides is a particularly inexpensive and cost-effective intervention for reducing suicide rates. Promoting child and adolescent mental health is another priority. Effective approaches include policies and laws that protect mental health, support for caregivers, school-based programs, and improvements to community and online environments. Among these, school-based social and emotional learning programs are especially effective across all income levels. Mental health at work is a growing area of interest and can be supported through legislation and regulation, workplace policies, manager training, and targeted interventions for workers. Mental health care and treatment. National efforts to strengthen mental health must focus not only on promoting mental well-being for all, but also on addressing the needs of people with mental health conditions. This is best achieved through community-based mental health care, which is more accessible and acceptable than institutional care, helps prevent human rights violations, and delivers better recovery outcomes. Such care should be provided through a coordinated network of services that comprise integrated mental health services within general health care, typically in general hospitals, and through task sharing with non-specialist care providers in primary health care. Dedicated community mental health services, such as community mental health centers and teams, psychosocial rehabilitation, peer support, and supported living, and mental health support in non-health settings, including child protection services, school health programs, and prisons. The vast care gap for common mental health conditions such as depression and anxiety means countries must also explore innovative approaches to expand and diversify care. These include non-specialist psychological interventions and digital self-help tools, which can be scaled efficiently and affordably. Why is mental health important? Mental health is important because it can help you to cope with the stresses of life, be physically healthy, have good relationships, make meaningful contributions to your community, work productively, realize your full potential. Your mental health is also important because it can affect your physical health. For example, mental disorders can raise your risk for physical health problems such as stroke, type 2 diabetes, and heart disease. What can affect my mental health? There are many different factors that can affect your mental health, including biological factors, such as genes or brain chemistry, life experiences, such as trauma or abuse, family history of mental health problems, your lifestyle, such as diet, physical activity, and substance use. You can also affect your mental health by taking steps to improve it, such as doing meditation, using relaxation techniques, and practicing gratitude. Can my mental health change over time? Over time, your mental health can change. For example, you may be dealing with a difficult situation, such as trying to manage a chronic illness, taking care of an ill relative, or facing money problems. The situation may wear you out and overwhelm your ability to cope with it. This can worsen your mental health. On the other hand, getting therapy may improve your mental health. What are the signs that I might have a mental health problem? When it comes to your emotions, it can be hard to know what is normal and what is not. There are warning signs that you may have a mental health problem, including a change in your eating or sleeping habits, withdrawing from the people and activities you enjoy, having low or no energy, feeling numb or like nothing matters, having unexplained aches and pains, feeling helpless or hopeless, smoking, drinking, or using drugs more than usual, feeling unusually confused, forgetful, angry, upset, worried, or scared, having severe mood swings that cause problems in your relationships, having thoughts and memories that you can't get out of your head, hearing voices or believing things that are not true, thinking of harming yourself or others, not being able to perform daily tasks like taking care of your kids or getting to work or school. What should I do if I think I have a mental health problem? If you think that you may have a mental health problem, get help. Talk therapy and/or medicines can treat mental disorders. If you don't know where to start, contact your primary care provider. Thank you for watching this video.